show, you've got right hip pain on the anterior side. Can you show me where it is? That's your right side. And so there, this is where our pain is, and that's in the anterior quadrant, and it's in the area around the quad attachment, just around here, just below the ASIX. And so then, if I press into it, does it hurt? No. Okay, a little tender. If I press more, does it hurt more? Yeah, the tissue feels normal. It feels like I said, like one tendon or something. But the density is normal, the texture is normal, it doesn't feel like any swelling. The temperature feels normal. It feels more like other tissue too. The tone is normal. If I get you to, by pressing here, does it refer down? Yes, you're making that up. And so that's all right. And so then, so that would be an example. Maybe there's a trigger point there, so we'll do some more palpation in that area to see if that's part of the problem. When we're doing that, like, that's one thing I think is probably confusing when you're doing, why am I doing this? But if we think about the idea is that our specialty is muscles. And oftentimes, if there's a problem with a tendon, we can't fix that. But we can reduce secondary pain by getting rid of that trigger point. So if we can identify a component of the pain that we can have a solution to, that's pretty good. And so think of that as just adding information to your palpation. So then I'll move on to rule outs for the hip and neurological. So for rule outs for the hip, we'll do the knee and the SI joint. So for the knee, we'll get you to bring your, in this position is good, I'll get you to bring your heel to your buttock. The overpressure, okay, that feels okay. Okay, and your hip with that? Okay, so that rules out the hip. So that simple statement gets you a mark.
Yes.
When that happens a lot, where people don't summarize what you've done. But remember, this is done for display purposes. You're acting, and you're trying to show you have understanding. So it's not about doing it, but it's about doing and saying it. And that one thing, just saying, that rules that out, it allows you to move on to the next thing. And you get marks for it. So you get marks for doing it, but you only get half the marks for doing it. You get half the marks for saying it. So then, for the knee flexion was one, and then extension was the other, and that was okay. And there's no pain in your hip, so that rules out the knee. So I'll do your SI joint now. Actually, I'm not going to do the SI just because the location is close. If I were to do the SI joint, I would do this and go like that, and then or go like that. Do both of those things. And those things are really close to where the area is. So I'm going to do the back rule out. So you just stand up. Over here. And so I'll get you to touch your toes. Does that feel okay? Just touch. Okay. And if I press, does that feel okay? Okay. So there's no pain in your hip there, right? Okay. Then if I get you to put your hand on your buttock, just one hand, and then slide that down to your back of your leg. Does that feel okay? There's no pain in your hip with that, right? Okay, great. So that rules out the back. So now I've ruled out the back and the knee. Okay, lie down. So now I'm going to do neurological testing. So I'll do dermatome testing for his hip. And so I'm going to bring your leg across like this. So I'm going to touch your leg on the inside. Is that okay? Yep. Great. I'm going to just to make sure that the sensory, your sensory nerves are working well. I'm going to move down in all four quadrants, and if at any point you feel uncomfortable, or if you feel that you can't feel what I'm doing, let me know. Okay. So I'm just going to use my hammer. So then I'm going to come through here. Does that feel, you feel normal? You close your eyes, that's great. Coming in, that feels okay in here? You feel that all the way down? That's great. And then coming through here, great. And then coming through there, that feels okay? Yeah, great. So there's no loss of sensation during that. If there had been, it may indicate there's some sort of pressure on a sensory nerve, but there's no indication for that. So we'll get you to do, I'll do a myotone test now. I'll do it for something that doesn't involve the hip. So I'll get you to stand up, and I'll get you just to walk on your tiptoes for 5 seconds. Just keep walking and hold that. 1, 2, 3, 4, 5. So you don't feel any weakness on the right side. If there had been, that might indicate that there's something like a fatigable weakness, where there's a nerve problem going to the muscle that makes it get tired over time. That's not happening. So that means that's a normal test, and there's no indication that you have a nerve weakness in your muscle. So that's the rule outs for the hip. Now we'll go into doing the range of motion testing for the hip. So with the range of motion, we have 6 ranges of motion, and extension is the most painful. So what we're going to do is we're going to get you to bring your knee to your chest. Okay. And so 90 degrees is here. That's about 110, 120. That's a good range of motion. Do overpressure. Is any pain with that? Good. Okay. So then again, you come out this way. Move your leg that way. Straight. That feels okay. Okay, I'll do overpressure. The range of motion is about 60 degrees, and the overpressure is a tissue stretch. I'm going to come across here, do this way. Relax, relax. Bring it across, great. And then I'll do overpressure. And you can do this a bunch of ways, but I like that way because you get a better range of motion. But if you were to do it that way, that's fine. Or if you do it that way, that's fine. But you get something blocking it. You don't get as much movement. But you choose what you like. And so then we've got 3 left. We've got rotations, and we've got extension. So with rotations, there's 3 of them. And you want to pick the one that works for you in terms of your, what you see. Because it's weird with the hip. Because if I do this, right, I'm turning the foot inward, the hip's moving outward. That's confusing, right? And the similar moving in, that's confusing. You might find that this is easy because you can see it by simply moving the leg out in rotation. And that way, you can see it, you know what you're doing, you know which way it's going, and you know that you can feel that this way doesn't go as far as this way goes. So then, that might be one you like. There's another way you can do it on the side, turn over and you do it. But, So then, but if we were to do it, you can choose. Like here, for example, what I like about this one is I get a really good, this becomes an amplifier, and I can see how far it goes. Right? So I see more. And I can see that this does more than that does because of how far it goes, right? And so that's kind of one of the reasons you might like that. And they get you to turn over. When you turn over, you want to keep track of the hip to make sure you're still on the same side. And so then when I come over like this, I'm going to just try the rotations again. So here that's external rotation, and there tends to be a large range with that. And this is internal rotation, and that tends to be about normal. Watch this little trick though, just a little side note. Get you to push your foot in. Relax, deep breath, let it go. And then it drops out further. Just the tightness in the piriformis group gets you more range of motion right away. And then the last one is extension. So if I get you to lift your hip up, okay, that's good. Is that any pain with that? No, but that can be hard to do because it's a big range, but it's an effective way to get range of motion. And for that one, you expect to get about 15 to 30 degrees. And then overpressure would be the same thing, just doing it overpressure. So there's your ranges of motion for active with overpressure. And then we would do resisted testing. Can I get you to turn over again? Yep. And so resisted testing, you can do the same way, but you can do it quicker. Because you don't have to hold it for 5 seconds. Just try to see how strong it is. So push up, push in, push out, push down, and then rotate, relax, push out, push in. They're all great very 5 strong pain trees. So that's our ranges of motion. We've got 30 marks doing that. So now I've got an anterior hip pain, and I want to think about something I can do for length and strength testing that will add more information to this area. So because it's in the front and the quads go there, and I'm doing the hips, so I'm not going to be testing the quads. The quads are a good way to go here. So I'm going to get you to come to the edge of the table. And so, that's great, thanks. Move right to the edge. Nope, right then. Okay. I'm just going to get you to push up. Does that hurt? You know, strong. And so then, but that would be a quad test, is different from the psoas test. And so then I've got new information for a muscle test that's really specific. So if that were to hurt in that area, I would think, okay, quad, maybe quad strength. Right? But if not, it rules it out and it's in the same area, so that's really good. And then for quad, I might do a quad length test because he says he's getting pain with extension, just to see if that, when we stretch it, it gets pain. So I'll get you to turn over. Go up that way, yeah. So for what we do is just bring the heel to the buttock, and he's got a good range of motion there. That's full range. Is there any soreness in that? A little tight. Okay, a little bit tight, but the range of motion was great, so he's getting pain with that, so maybe that's part of what's going on. So that's my length and strength test. And now all I've got left to do is my range of motion, sorry, my special test. So I'm going to get you to turn over. And lie down. And we'll do, because he's done, it's an anterior thing, I'll do, you could do something like Thomas test if you wanted. But I'm going to do a quadrant test or a figure test. So that one comes up like this. Move your hands out of the way. Come up. And I'm going to rotate out. And I'm going to come like that to see if that recreates the pain. Does that feel okay? And so we can come into, no pain with that, right? Okay. So that would be one, and then I'll do quadrant test. Coming across like this, slowly coming across, that feels okay? Good. So both of those tests were negative. If they were positive, they would reproduce anterior groin pain, anterior pain or groin pain. They didn't. So now we've got a clinical impression. So I'll go through the details of that. So in terms of just being specific about what's being asked on the scenario for the special test. So those tests were negative. If they were positive, they would reproduce the pain here. One test, both tests were interior and kind of joint pain in the hip, and that didn't cause it. So they were negative, meaning because they didn't do that. And so then, and we did it twice, and so we're good for that. We'll move on to so far, we'll move on to the clinical impression. And so far, I think it's happening in the muscle, not the joint, because we had some of the tests that the length test reproduced it in the quads. And then we move into the clinical impression. What we found so far was just a little bit of point tenderness and with some pain, maybe with stretching the quads. So it didn't cause it, the pain didn't happen with the strengthening part, but it did with the stretching part. So we'll have to play with that. We get treated, see how it goes. There was a trigger point referral, so we'll treat that to see how it goes. So my clinical impression would be that it's a muscular tightness right now. And let's treat it and see how it goes. I don't think there's anything that I need to do that would kind of cause a problem. All this is kind of within our scope of practice, so we can proceed with the massage. That's okay. Great. All right, so it's a lot, but the idea of it is really trying to be thorough as you go through it, to try and get a sense of each